Hi, everyone. I'm Loretta Bush, President and CEO for Authority Health. And in February, many of you know, we turn our attention to matters of the heart. Maybe you have already started thinking about how you're going to share love to your special Valentine. But in addition to that, it is also Heart Month, and it's observed by the American Heart Association as well as many other national organizations, with the goal of bringing attention to the ongoing fight against cardiovascular disease. And I'm going to start off by just giving you one quick fact, and it's a disturbing fact that heart disease still is the leading cause of death for men, women, and people of most racial and ethnic groups in the United States, and that one person dies every 36 seconds. Now, that's every 36 seconds in the United States from cardiovascular disease. And that's according to the Center for Disease Control and Prevention. Now, today, I'm very pleased to have someone with me who's going to shed some light about prevention and control of heart disease. And that's Mr. Michael Randall. I'm probably going to call him Mike at some point because he says it has less syllables, easy to pronounce, and we like easy. Whatever we can do, that's easy.
100%.
But Mr. Randall, go ahead, Mike.
Absolutely. Yeah.
All
Less
right.
syllables, easy to remember.
There you go. Mr. Randall is the Senior Director of Community Impact for the American Heart Association. Mike, thank you so much for joining us.
Absolutely, Loretta. And I appreciate the time and the platform. And I'll be remiss to not say that, we at the American Heart Association truly value the partnership with you and Authority Health. And so on behalf of the AHA, I just thank you for the platform and the time. Really appreciate it.
Thank you so much. We feel the same way. All right, well, let's just jump right in. Talk to us about the American Heart Association, and then zero right in on what you are doing to help control specifically hypertension.
Absolutely. So, the American Heart Association has a long and storied history, about 100 years of primarily research. So, looking at research, looking at science and evidence-based, initiatives, as well as procedures when it comes to surgery and treatment and pharmaceutical remedies and things like that. The foundation of the American Heart Association is research, and that has guided our initiatives, has guided our approach to heart disease for pretty much a century, right? And we've done phenomenal work in that space. If you think about things like the pacemaker, if you think about, different pharmaceutical drugs that help hypertensive patients and patients that are dealing with high cholesterol and even congenital heart failure and things like that. We've made a lot of progress in that space, but as you mentioned in your intro, heart disease still remains the number one killer. I would say probably within like the last 20 years, the AHA has really pivoted the approach, still with a research foundation and an evidence-based foundation, to really start looking at things called social determinants of health. We think about things like housing, we think about things like access to employment, access to healthy food, a full service grocery store. We found that 80 to 90% of heart disease is preventable when you look at the risk factors that social determinants of health really perpetuate, especially when it comes to minority communities. So the AHA, being true to our core mission, really took a deep dive into social determinants of health and started hiring people like me. I'm an urban planner by training. I have a background in housing and community development. But if you think about, again, those SDOH issues, and when, we look at the risk factors, what role can the American Heart Association play when it comes to social determinants, and how can we create solutions in that area? And so when it comes to hypertension, again, we see that Black and Brown communities and populations are disproportionately impacted. And so what are those social determinant overlays that you can put in perspective to really start finding solutions. So we think about things like diet, when you think about things like physical activity, when you think about
Right.
things like cultural norms, right? Weight management, access to healthy food and preparing food a certain way. How can we start looking at education as a conduit for managing blood pressure and also, looking at insurance and providing blood pressure monitors that may not be covered from traditional insurance mechanisms. And so those are
So,
the things
Michael,
that
I
we've
can tell
been
this is your passion because I don't even
absolutely.
have, all I got to do is ask you one question and you can just go and go. But I do
Yes.
want to just say, how impressed I am that the American Heart Association was able to do that pivot, because you
Mm-hmm.
started off by saying, kind of a traditional R&D, research and development, evidence based, which
Mm-hmm.
is very important. But then, you talked about the medications, the pacemakers, all of that. But then this pivot that said we have to look at how people live and
Absolutely.
where they live and how they live,
Mm-hmm.
how that's impacting. Long before we need a pacemaker, how are we living? Where are we living? What are
Absolutely.
we eating? How are we exercising? How do we optimize what we know about communities and how people live? And I love the fact that I see
Mm-hmm.
housing and policy there in your
Mm-hmm.
background. And who would have ever thought back years ago that the American Heart Association would be hiring a African American guy with a housing background?
Mm-hmm.
That just shows how far knowledge has come
Absolutely.
about how we really prevent and control illness, right?
Absolutely.
It's not
Absolutely.
just about the pills and the pacemaker. It's
Mm-hmm.
about such things as housing and having people who understand the culture and how we live, work, and play.
Absolutely. I could not agree more. And, zip code disparities and that being, a widely accepted issue that we see. And if you look at our great city, I live here in Rosedale Park, but if you go to maybe Brightmoor or another community and you see life expectancy go down, right, when it comes to how long people are living and how well people are living, and then what are the educational barriers, what's the area median income, what's the access to a full service grocery store, is there public transportation there, right, what's the rate of violent crime. Like when you really overlay these census statistics, then you start to really see the pronouncement of SDOH, and I'm really happy that the AHA is looking in this area to solve and find solutions.
Absolutely. So then, I know that you've described it beautifully, that, the difference between, if you're living in Rosedale Park or if you're living in Brightmoor or some other areas, because we know that, that place does matter. But then what is a person to do? If I'm the person living in an area that is a food desert or a food swamp, if I'm someone who's living in an area where I don't feel safe, going for the evening walk or the
Mm-hmm.
evening run, that kind of thing. But clearly, I want to reduce my risk of heart disease. What does the American Heart Association say to someone like me? How do I start? Because I know that
Absolutely.
it's a priority. We've got to
Well,
get this, we got to do this thing.
and I couldn't agree more. And I'm a community guy, so I love connecting one-on-one with neighborhood associations and faith-based organizations and whatnot. And so I don't think that anyone should have to deal with the fact that their neighborhood isn't safe or doesn't have a pedestrian walking path where they can cross the street safely. They have to live next to an incinerator or illegal dumping. I don't think that that's okay at all. Unfortunately, we find ourselves in that situation. So I think that it's a spectrum of connectivity that needs to be had when it comes to organizations like the American Heart Association. Again, working on the grassroots level with neighborhood associations, setting up walking clubs, providing small mini grants for faith-based organizations to set up food pantries, right? And then maybe doing healthy eating education during those food distributions, right? But even to scale out, right, and go a little bit more macro, how can we work and to create policy systems and environmental changes? And so we don't always have to take a programmatic approach to these issues, right?
Right.
We have policies in place that that build pedestrian walkways, that build walking paths, and redevelop open spaces for physical activity and parks, and removes blight, right? I think that it needs to be a approach that's done in tandem, right? Grassroots, really granular, connecting shoulder to shoulder with individuals and stakeholders on the community level, but also working with our local government, working with our state legislators, and even our federal legislators to make sure that we create these environments that are conducive for a long and healthy life.
Wow, there was a lot in there, very important. You talked about, working at the grassroots level,
Mm-hmm.
connecting with local partners, connecting with, block clubs and faith-based organizations. I
Absolutely.
love the fact that you mentioned, talking to your elected officials, because they work for us, be there, the local, state,
100%.
federal level. There's a lot of empowering statements in there. You
Absolutely.
really that it sounds you're encouraging people to be a partner in their own solution, which is
Absolutely.
very, very important. I want to switch gears a little bit now and talk specifically about a couple of groups. One is the younger populations. How do we look to direct these prevention efforts to the younger populations? Because I know, when you start talking to younger people about cardiovascular disease and hypertension, that just sounds like light years off.
Mm-hmm.
But we want to go upstream, right? It's like
100%.
you got to start protecting your heart immediately,
Yeah.
not after you've abused it. You want to take care of it soon. So how do we get
Yeah.
this message and make it important to young people?
I think you hit it on the head. Awareness, what kind of quality of life do you want? And understanding that these risk factors that you may be exposing yourself to due to poor diet, lack of exercise, stress, right?
Yeah.
Things like that. These risk factors can lead to a long-term health issue that will definitely hamper your quality of life. And so, meeting young people where they are, the young and invincible, as they say, these
Yeah.
health, issues are not mine. But the data shows that, more and more younger people are dealing with hypertension, more and more younger people are dealing with high cholesterol, obesity, and other risk factors that lead to cardiovascular disease and stroke. And we're also seeing younger people having heart attacks, dealing with strokes and things like that. And so I think that it starts with awareness, but really posing the question: what level of quality of life do you want to live, and
Yeah.
how important is that for your life trajectory, for your career, for your family? And then take the next step. What do you need to do to set yourself up for success?
Yeah.
And one of those one of those things that we really try to instill into the community that are working with even younger individuals, like toddlers and elementary school age, is what are some healthy habits that parents can instill in young people at a very early age? I have a 3-year-old, and so every day, we wake up with a smoothie, and we put vegetables, and we put fruit, and we put his vitamins in there, and that's his palate, right? Like, he
Yeah.
wakes up and he asks, where's my smoothie? I'm ready for my smoothie, right? And so I think that there's a lot we can do to encourage young people, but also young parents to instill these healthy habits within our adolescent youth and our toddlers, so they can grow up with these habits that are already instilled in their day-to-day life.
Yeah, you spoke volumes again there too. We teach our children, we train their palates, right? Instead of
As,
talking about, well, they don't like this and that. Well, that's because you didn't expose them to that,
mhm,
kind of expose them to it two, three, four times before you just kind of pronounce my kid doesn't like green things.
absolutely.
Maybe it's you that don't like green things, right?
It's so interesting with my son. Like he loves raspberries. I'm like, raspberries they're not the sweetest fruit.
Yeah,
They kind of are a little tart and they're a little sour. But I think he really likes the texture. But every time we go to the grocery store, he's begging for raspberries, right? He's not asking like for a raspberry flavored Skittle, right? Like he's
right.
asking for an actual raspberry. And so
Raspberry.
you're absolutely right. We do train those palates, but it starts with education, right? Like I'm fortunate to work for the AHA, and I have a lot of education when it comes to, healthy eating habits. And so that, kind of matriculates down to my day-to-day interactions with my child. But, we definitely can do that more. And, that's the job of the American Heart Association and Authority Health to make sure that we're making this education more accessible.
Right. And if we can't get to like the fresh fruits and vegetables, is it okay for us to use the canned fruits as long as we try to
100%.
find the ones without, too much added sugar? Because we
Yeah,
want to be realistic about what people's lives may or may not be. So
$100%.
if I can get, something and look, read labels and try to find the ones that don't have too much added sugar and preservatives and stuff like that. Maybe, we don't want to do can shaming, right? If
No,
I
no, no,
can't
no,
get
no,
to,
no, no. I
yeah,
grew up and I still eat canned vegetables.
yeah,
But looking at, like you said, the low sodium,
yeah,
low high fructose corn syrup, and
yeah,
maybe not getting the peaches with the heavy syrup, right?
yeah,
Just really looking at those labels, and that's one thing that we do with food pantries is help to create policies to where they'll have signage for those type of canned vegetables and fruits. And so they'll be able to have choice, right? Like this is the area where these might be high in sodium, maybe high in added sugar. And so you want to create agency where individuals can make that decision for themselves, but every opportunity is an opportunity for education. And so that's what we try to do with food pantries. And so absolutely, we want you to get that recommended portion of fruits and veggies every day. And if you are an individual that is procuring food at an emergency food source, we want you to have that option as well.
absolutely. Now, Michael, I don't want to catch you off guard, but is there a number or a website that you want to share with our listeners so that they can find out more about, how they can get education from you or someone at the American Heart Association? I'd love for you to share a number and a website.
Absolutely. So AHA.org is the best source of all of this information that I'm sharing right now. Go redforwomen.org as well. So of course, this is Heart Month with a special focus on women's health. So I want to put that out there as well. As far as a number, I don't have a 800 number or anything right now, but what I can do is I can put my email address in here. So it's Michael, MICHAEL.Randall, RANDALL @heart.org. And I am here to serve you. I'm here to serve this community. So any question that you have regarding education or community initiatives or policy systems and environmental changes, please feel free to email me and I would love to connect with you.
All right, that sounds awesome. And then you did mention women, and that's exactly where I was going. Talk a little bit about specifically what the American Heart Association is doing to address heart disease in women. Go Red for Women is one of my favorite initiatives. So talk
Mm.
more about that.
Absolutely. And so this month is Heart Month. And so this is an opportunity for us to spread awareness about heart disease as a whole for the entire population, but also an opportunity for us to pause and really reflect on a specific population that is increasingly becoming more disproportionately impacted by heart disease. You know, historically, you know, a heart attack was called the widowmaker and was
That's right.
you know, seen as a disease and an ailment that only impacted men, or, you know, disproportionately impacted men. But, you know, what we see more and more is that, you know, cardiovascular disease kills more women than all forms of cancer combined. And yet
Right.
only 44% of women recognize that cardiovascular disease is their greatest health threat. And then when you look at minority women as well, 50,000, Loretta, 50,000
That's
African
amazing.
American women die every year from heart disease, but unfortunately, only 1 in 5 know that it's their greatest risk to their health. And so this is why we use Heart Month to really have a specific focus on women's cardiovascular health. We use February 4th, which is Go Red Day. So Loretta, I'm
Yes.
looking forward to seeing you and your staff and your best red
Oh,
post
I
that in
got my
social
outfit
media.
ready and my pen.
Absolutely. Yes. Yes, indeed. So I'm looking forward to seeing that. And that's how we spread awareness, right? That's how we get these numbers out. The 44% of women that only recognize that cardiovascular disease is their greatest health threat. Let's get that percentage up, right? And we
Yeah.
do that through awareness, our Go Red Day, our Go Red for Women luncheon. That's February 25th this month, and the entire month of February. And so the number one way that we can educate the population about these numbers, and about the risk factors, and about the resources that are available is through awareness. And we do that with awesome partners like you and Authority Health and others to, again, use their network and use their leverage to raise awareness and bring about change.
Excellent, excellent. And I'll just stop right here and do a little bit of a plug. One of the other ways to ensure a healthy heart is to have regular primary care exams. And if you
100%.
or someone you know is in need of a primary care physician for yourself, for your child, for a loved one, we at Authority Health would love to be your primary care provider. We
Absolutely.
offer primary care in the community, and you only have to remember one number, and we will then connect you either to our pediatric practice or our family medicine practice. And the number is 313-824-1000. That's 313-824-1000. Now, Mike, we're getting to the end of our time together, but I know that the American Heart Association is launching a program to address something called It Takes a City
Mhm.
Collaborative. Do I have that right?
That's correct. Yeah.
All
Mhm.
right. So tell us about this program and how it will have an impact on CPR equity.
Absolutely. So the It Takes a City initiative, I'm really, really excited about it. It's an initiative that we're really using our fantastic board. So we have representation on our board from some of the largest organizations in the state of Michigan, and really using our board, again, leveraging that network and leveraging their very specific expertise to focus on two very important issues that are impacting our city. One is out of hospital cardiac arrest survival rate, one of the lowest survival rates in the nation, as well as hypertension. About 1 in 3 individuals in the city of Detroit are dealing with some level of elevated hypertension. And so, how can we use our board to impact these very specific areas and bring about solutions? And so, the It Takes a City Collaborative is looking to educate individuals when it comes to blood pressure, when it comes to managing their blood pressure at home, as well as training over 100,000 individuals with hands-only CPR, as well as equipping ambulances with a mechanism called a Lucas device, which does automatic chest compressions if an individual has fallen into cardiac arrest. And so these are areas that we're looking at. And these two very specific areas are disproportionately impacting the city of Detroit when it comes to our life expectancy. And so I'm really excited about it. I know Authority Health is going to be involved in our stakeholder sessions and our listening sessions to really hear from experts to see how we can best deploy these resources to make sure that we're making the impact that we intend on making. And so it's really about training for hands-on CPR, as well as equipping ambulances with this device, and also doing education around hypertension and self-monitoring blood pressure, so we can see reduction when it comes to elevated blood pressure in our city. So I'm really excited about it, and I'm
Mike,
looking
so
forward to
are
Authority
we.
Health being involved.
I really want our listeners to understand how impactful this is going to be, so that when someone in our community or in our home goes into cardiac arrest, and that means their heart has stopped and they are dying, that we are able then to perform CPR until help can come. And you are making a very important point, hands only, because sometimes people have been hesitant to do the mouth to mouth, and they are hesitant to help because they've seen on television the need to put their mouth to a stranger's mouth, or sometimes even to another relative's mouth. And us being in this pandemic situation makes it even less likely that someone's going to put their mouth to another person's mouth. But just imagine a whole community, a whole city who knows hands only CPR, so that if you or someone you know falls victim to cardiac arrest, there's someone trained and willing to begin and continue doing CPR until help arrives, or you can be transported to a hospital. Life expectancy and the potential of being able to survive just increases. And Authority Health is so excited to be a partner with you on that. And I just think that that's a excellent note to end on, because as I began, February is the month that we think about all things heart. And the American Heart Association certainly just brings all of its resources to bear. Michael Randall, thank you so much for being my guest today. Is there any final word that you would like to have before we exit?
No, I just want to thank you, Loretta, and thank the staff at Authority Health for this partnership. We are truly honored and grateful for the work that you all are doing in the community, and just love the fact that we can walk shoulder to shoulder and make changes in our city and our region. And again, AHA.org, my email, michael.randall@heart.org. If you are working in any of these specific areas and you would like more resources or more, connection with the American Heart Association, please reach out.
Wonderful. As always, knowledge is power. I'll see you next month.
Thank you.